Welcome to Hopkins at Home. Thank you for joining us. I am Sarah Hoover, Associate Dean for Innovation, Interdisciplinary Partnerships, and Community Initiatives at the Peabody Institute. My work includes the development of music programs for patients and healthcare providers in collaboration with the Offices of Wellbeing and Service Excellence at Johns Hopkins Medicine. My team is also in charge of training and student fellowships to prepare Peabody Conservatory students for this work. Today, we'll be talking about the intersection of the arts and health at Johns Hopkins, and more specifically, we'll be talking about music in the healthcare environment, both programs underway and a vision for the future. We welcome you to ask any questions you have by typing them into the chat module on your screen throughout the talk, and we will leave time at the end to answer them. So now, let's jump right in. You may be familiar with arts activities across Johns Hopkins Medical Campus, programs like Child Life, and the beautiful visual art located throughout many clinical settings. You may remember the work of Dr. George Udvarhai, and later the work of Dr. Charles Lim in championing the arts within medicine. You may be aware of current initiatives ranging from literary groups like Afterwards, to the Center for Music and Medicine, to holiday music in Zayed Lobby presented by members of the Baltimore Symphony Orchestra, and Peabody musicians featured in a concert series called Music Connects, sponsored by the Department of Radiology. In fact, there is an extraordinary amount of activity taking place across the campus. A recent environmental scan shows that Johns Hopkins University and Hospital benefit from a variety of compelling assets in arts, health, and well-being. Building on these assets, a cross-university steering committee launched a conversation about the potential for a large-scale initiative in arts and health and well-being at the university. To date, data collected indicates of 109 individual organizations and initiatives included in the scan, 58 are focused on healthcare providers and faculty, 43 are focused on students, 28 on the broader community, and 26 on patients and families. The steering committee has engaged Jill Sankey, Director of the Center for Arts in Medicine at the University of Florida, UF Health. Her report and recommendations will be published early in 2021. Her preliminary findings suggest that Hopkins is very well positioned to become a leader in research, clinical practice, and education at the intersection of the arts and health. Coalescing these individual activities under one large umbrella seems timely. The arts have never seemed more valuable for their capacity to heal. It's been a very hard year for both healthcare providers and for musicians. It's also been a tough year for those of us who educate and train both. So how are musicians doing in the midst of this pandemic? Our venues are shut down. Our teaching and learning have gone virtual, and many of us have been in our homes since March. We have lost performance income and are underemployed or unemployed. We feel isolated and alone. We miss being able to make music together. We miss sharing our music, and we miss our audiences. We want to be relevant and of service in the midst of an unprecedented health crisis. So here are a few examples of how musicians have responded in the past 9 months. In the Barcelona Opera House, the hall was opened for a performance by the Useli String Quartet to an audience of 3,000 potted plants, each of which was then given to a healthcare worker as a token of appreciation for their service to humanity. Despite the fact that tours and seasons are canceled and halls are mostly closed, except to plants, musicians have been active and their work has been picked up by the media as beacons of hope in dark days. In New Orleans, musicians are serenading those in lockdown from the street. Here, a group of opera singers. In Atlanta, singers from the Atlanta Opera have sent singing telegrams, which are personalized with special dedications to individuals who are unable to leave their homes. In New York City, musicians have organized community music efforts like 10th Intervention's citywide symphonic fanfare, which invited trained and untrained players to join together in a collective 10-minute work of cheering, reflection, catharsis, and gratitude. Music continues to be recognized for its value in our recent crisis, but music has long supported healing ever since there has been music, and long before there was medicine or music therapy. Evidence of these relationships between music and medicine are found in pre-literate societies and cultures and throughout the evolution of biomedicine. Music-centered healing practices are found across numerous cultures, notably but not exclusively in Native American, Judaic, Indian, Islamic, Christian, African, Tibetan, Aboriginal, and South American cultures. One can observe parallels between the disciplines and practitioners of music and medicine in Egyptian and Greek history. Parallels such as these pervade human history, with connections between music and medicine, music and health rooted in social, spiritual, cultural, physiologic, and psychologic mechanisms. In these ancient practices and in these various ways, music has been used as an intermediary between body and soul. The connections between music and medicine endure. Here are the highlights of what has been validated by research thus far about music's value in clinical settings. Music has been shown to reduce healthcare costs. Access to music can result in shorter hospital stays due to faster recovery, fewer complications, and less medication due to reduction in perceived pain levels. Music in the healthcare environment has been shown to promote healing and workplace satisfaction by reducing stress, improving mood, elevating staff morale, and offering positive distraction. Music programs and interventions have been shown to bolster patient experience scores. Overall, music has been shown to be a cost-effective, even cost-saving way to deliver a range of positive outcomes. As defined in 2017 by the National Organization for Arts in Health, the field of arts in health is dedicated to using the power of the arts to enhance health and well-being in diverse institutional and community contexts. The arts in health practitioner uses art to enhance the healthcare environment, to improve patient outcomes, and to increase overall well-being. The field of arts and health intersects with the fields of the creative arts therapies in multiple ways. As the field matures, training programs and academic degrees, professional development opportunities, a code of ethics and standards of practice, and forthcoming certification are all underway. This diagramming from our forthcoming book maps a taxonomy of the types of encounters patients may have with music along a spectrum of engagement, from music as environmental influence through music presentation and music as response to music as dialogue. Music activities are arranged along the spectrum in relation to the degree and type of facilitation required, as well as how impersonal or interpersonal they are. Some activities can be undertaken with no facilitation, others by non-musicians or by musicians of varied skills, or by trained specialists like the musician in healthcare or the music therapist. This spectrum is not hierarchical. No one kind of activity is better than any others, but rather it maps a range of musical activities, each beneficial for and appropriate to the patient and the environment, depending on the context. As programs develop across the world, just over half of hospitals in the United States, music programming includes some combination of the items on this list, including concert series in public auditoriums and public spaces, environmental music played in lobbies, waiting rooms, and other interstitial spaces, music at patients' bedsides, and music-making activities for healthcare providers. As programs develop across the world and here at Johns Hopkins, we'd like to share our vision for the future. In the future, patients and healthcare providers can expect the arts in the hospital, wherever they are. Patients and guests look to the healthcare system to inspire creativity. They can take classes, interact and collaborate with artists, and attend or participate in concerts. Concerts provide a platform for celebrating the musical assets of the surrounding community, as well as visiting artists. Music programs influence where consumers choose to go for their medical care and where medical professionals choose to do their work. The hospital provides accessible free programs for those who would not otherwise patronize the arts. In the future, music programs in hospitals are inclusive of and responsive to the community's artists and musical traditions in which the hospital is located. And music schools prepare graduates with the requisite skills and mindsets to respond to local hospitals' needs. In the future, there is access to musical instruments and spaces for music making spread across the medical campus. Pianos are left unlocked and ready to be played. Volunteer and professional musicians are filling spaces with music that inspires and heals. Music rooms for patients and healthcare providers are integrated in appropriate locations throughout the facility. Instruments are available to healthcare workers to relieve stress and foster creativity. In the future, music and the arts are used to support healing throughout the spectrum of care. The arts are a resource offered to patients and their families during hospital stays. Their preferences are captured upon admission, which indicate the best ways to support them during their stay. Care is provided in the clinical setting and then in the outpatient and post-operative arenas as well. In the future, the field of arts in health is recognized as part of the allied health network of care providers. Along with creative arts therapists, artists in healthcare are listed as specialists within the allied health professions. The arts are recognized within the healthcare system as a form of healing. Qualified artists obtain training, certification, accreditation, and licensure as allied health professionals and are held to a code of ethics and standards. Licensure is contingent upon the completion of regular continuing education. In the future, music provides support for healthcare providers in their daily work, as well as their personal and professional development. Musical activities are integrated into care providers' foundational training as part of medical humanities or other arts curriculum. On-site programs provide access to music performances and music making and learning activities to support their well-being. Music programs demonstrably improve workplace experience, morale, mood, recruitment, and retention among healthcare providers and staff. Here we have an example of the Longwood Symphony Orchestra, which is over 30 years of music making, an orchestra made entirely of healthcare professionals in the city of Boston. In the future, art lives as art within the healthcare environment, and professional artists partner with therapeutic approaches when appropriate. Artists retain their unique creative domains and attributes, but participate as full professionals in interdisciplinary teams. They can take part in rehabilitation or in patient care or in environmental enrichment. The art's power for healing extends beyond comforting us with what is already familiar to stretching us beyond what we know. Art expands our experience of care and healing. I love this portrait by Steve Derrick. It is both beautiful and arresting in the way that art can be. And it helps connect us with the truth of the situation for this healthcare provider in a way that other experiences cannot do as effectively. In the future, through interdisciplinary collaboration, we are able to create a transformed healthcare culture and a transformed arts culture. I'd like to share with you a quote from Nick Dawson, who just left his position as Executive Director of Innovation at Kaiser Permanente and formerly served as the Executive Director of Johns Hopkins Sibley Innovation Hub. He says, "We have a really bad culture problem in healthcare. The history of constructing institutions around doctors rather than around patients and communities has resulted in environments that are hard to work in and hard to receive care in." Dawson sees a future where artists are incorporated into teams redesigning the healthcare experience to, quote, "bring the perspective of someone who sees, hears, touches, and builds the world differently to the table." He asks, will art, and especially music, be a major catalyst in dismantling the barrier to humanity endemic to today's healthcare culture? Or will art be the result of a transformed healthcare culture? And my colleague, Moises Fernandez Villa, director of the Arts Lab at Boston Medical Center, says, let's be clear. Music will not save healthcare, and vice versa. Healthcare is not there to serve music, but there should be no excuse for these two worlds not to meet. Their potential speaks undeniably loudly. If they acknowledge each other fully, their encounter will unveil a culture of care that will genuinely transform both music and healthcare. And I would argue now more than ever. And now I'd like to dig in a little bit more and share with you some of the information about the programs that have been underway at Peabody. A number of projects have been under development in collaboration with Johns Hopkins Medicine for the last 3 years. The first program to be developed was a concert series begun with the Department of Radiology called Music Connects, which I mentioned earlier. That program ran for 2 years. And I'm happy to say that the evolution of George Udvar-Hái's Office of Cultural Affairs has now become the Office of Arts, Humanities, and Health at the university. And that concert series is now going to be reestablished once we are able to start live activity at the hospital under the direction of the Arts, Health, and Humanities Office. In addition to the concert series, a lobby music program called Music for a While has been slated to begin. Several new pianos will be brought into the campus, the medical campus, and added to the existing instruments. Some of them will be put in private spaces as practice rooms for healthcare providers and staff. Some pianos are already located in spaces available to patients, and another set of pianos will be put in public spaces within the lobbies and played by musicians from the Peabody Institute. A training program for these musicians has already been put into place, and we are right now training our first cohort of musicians who will be delivering their programs virtually for the time being, given the fact that we are unable to present programs in person at this time. In addition to the lobby music project, several spaces in the healthcare campus have been designated for pop-up music activity, and that will take place again when we are authorized to begin programming on site. The bedside musician program, which is called Sound Rounds, has been a partnership with the Service Excellence Department at the hospital. We've been very grateful for their support in providing music to patients. More recently, this bedside music program has also been made available to healthcare providers and staff through the Office of Wellbeing at the hospital. These programs have been delivered via Zoom at this time. We look forward to being able to resume the activity at the bedside, but during this time, those programs are available to patients and to healthcare providers virtually. In addition, we have begun providing a number of different forms of support, creative support for healthcare providers and staff. The first of these was an initiative out of Peabody called ArtReach, which provided opportunities to partake of virtual concert hall activity at Peabody through watch parties and our virtual concert hall resources. And then a mindfulness session led by one of our dance faculty, which has now been transformed into a set of well-being and mindfulness programming specifically for healthcare providers working in the COVID units. And this program is called Somatic CPR. And that is just being made available in right now at the end of this academic term. We also will be providing music activities virtually in the spring for healthcare providers, including a chamber music party, a virtual chamber music party, and also a creative movement class for healthcare providers as well. These are really only the beginnings of what we hope will become a much more robust program that will take its place alongside other long-standing 3- and 4-decade-long programs in the arts and health across the country and in fact across the world. We have high hopes for the future of the arts and health at Hopkins, and the potential for research, and as well as clinical care and training and education, both for arts providers and then also for healthcare providers. So at this point, I am going to check in with my facilitator here and to see whether anyone has offered any questions yet. And if there are no questions, but you've got one that you'd like to ask, I invite you to do so now, to send them in, and we will begin to go through answering those questions. And while that is happening, I'm going to go back through the slides and talk through with you a little bit about some of these projects that I mentioned a little earlier in the talk. So I wanted to share a little bit about this one. This was a project developed by Lisa Bilava, who's a composer who does a lot of broad compositions that invite the community and non-musicians to participate. So she actually submitted a call to musicians, amateur, professional, to share in writing an experience of what it has been like to be in lockdown. And she then took these fragments and created musical material from these text fragments and has knit them together into an ongoing multi-movement composition called Broadcast from Home. And this particular quote I find just extremely, evocative of what the experience has been for musicians right now. While Debbie Deanne recognizes that she herself is healthy and well, yet the sadness is crushing me. The loss of life, the broken-hearted families, the pain and suffering of so many makes my heart hurt. I miss hugging people, touching a hand, giving a pat on the back. I miss singing with all my friends, my band, and most of all, my choir. I miss hearing the sweet voice of others joined together in song. Every day seems the same. Every day something unanticipated happens. The weeks are flying by, yet the clock seems to have completely stopped. I am healthy, I am well, and I am crushed with sadness. I think this text really underlines the extent to which, whether one lives on the healthcare side or the arts side, we're all suffering from this sense of isolation, disconnection, and exhaustion, inability to be and do what we are and do. And then this next, I don't know if any of you saw this in the newspaper. This photograph was picked up. The hall had been completely shut down and was opened back up for a socially distant string quartet performance. But of course, the audience could not come into the hall because of restrictions on social distancing. And so these performers wanted to offer something that could be a token of their appreciation, and did so by playing to this community of plants and then sharing them with healthcare providers, as I mentioned before. The concept of singing telegrams and also just serenades. You may have seen, there have just been countless examples of this all around the world, organized and spontaneous, whether it's with pots and pans and kazoos or with cellos, clarinets, and voice. Folks singing and playing wherever they can to express their gratitude to healthcare workers, and also just to connect with people in this time. The singing telegrams were sent in particular to seniors who were locked in. And as I'm sure you know, healthcare senior communities have been devastated and have not had access to so many different forms of art that they normally have had, integrated into their communities. So a personalized singing telegram was one way that artists could figure to offer something specifically to folks. This project, I think, is relatively self-explanatory, but it was a wonderful cacophony, short cacophony at the 7 o'clock hour at shift change, when non-musicians, amateur musicians, and professional musicians alike, who downloaded a schematic score, and then began all to make music wherever they were, at the same time by windows and on computers, to share their appreciation for healthcare workers. I especially like the fact that this was led through 4 different stages of support, of musical creativity, which reflects, again, a lot of the emotional states that all of us are going through in this period of time. So I do see that a couple of questions have come in. So I'm going to answer these, and please keep your questions coming. We're happy to answer them. So the first question is from Jay, and the question is, how are medical students being taught to integrate the arts and music into their practice, if at all? Jay, I appreciate your saying if at all, because it's not a given that the arts would be integrated. And in fact, until recently, there has not been, across medical education or nursing education, a sense that the arts have value. This has really changed in the last decade or so. At this point, I can tell you about the few programs that I'm fully aware of. And what I can tell you also about being part of the Johns Hopkins enterprise is that there are all kinds of things going on in little pockets and corners, of which many of us may have no knowledge or awareness, which was the reason that we actually went about that inventory, that asset scan, to try to unearth as many as possible. So there are, and I don't remember exactly which year it is in medical training, because this is not my area of expertise, but in one of the, I believe it's in the first or second year, there is a module offered as an elective that students can choose to take, which either involves creative writing, or involves a partnership with the Baltimore Museum of Art on developing ways, observation skills and ways of seeing through looking at artwork. Improv has also been used in medical training, and it is my hope that those programs will increase in a more systematic way in the future. There are medical humanities courses as well, and I can't speak with any deep knowledge about exactly what they are, but I do know that there is increasingly access to that. There are also student clubs. There's a student music and medicine club that organizes music activities for med students. I'm sure there are also things going on in nursing and perhaps in public health as well, with which I'm not familiar. A second question comes from Chris. How is a patient at the bedside connected with sound rounds? Do they need to request this, or does the bedside nurse offer this to them? So, Chris, I'm going to answer your question first in a pre and post COVID scenario, which is to say, when musicians could be live in the hospital. So, this is handled differently in different bedside music programs throughout the hospitals that run these. But at Hopkins, a patient can make a request through their customer care service representative or coordinator. They're the CCSCs and CCSRs, who basically are staff whose job it is to help connect patients with resources. So that person rounds on the patients regularly and apprises them of many different programs that are available for patient support, ranging from dog therapy to manicures and massages, and also a visit from a Sound Rounds musician. So this patient care representative collects a list of the patients who are interested in having a visit. And when the musician shows up for their shift, they get a list of the patient rooms to visit, and they go and get that. They go and visit those specific patients. This delivery system has not translated well into remote delivery because, as you probably know, there are very few, if any, non-medical professionals allowed in many of the patient rooms at this time. So we've experimented with various ways. Right now, there is a Zoom link, which is common to all of the musician shifts, which have just restarted today. In fact, I think one of them started exactly the time that this program took place. And so a patient or family member, depending on who's in the room, clicks on the Zoom link, or a nurse can assist, a healthcare provider can assist with clicking on the Zoom link on the bedside tablet or on a personal device, and getting access to the Zoom event where the musician is waiting for them. So the musician performs live for a shift, and folks access that virtually. Patients do have the opportunity to leave a note in the chat if they'd like, but essentially the musician is performing in a one-way scenario in order to preserve patient privacy. We are going to be so happy for many reasons when we are able to bring musicians back to the bedside, because that one-on-one personal interaction is really the most powerful part of bedside music. And without that ability to connect directly with a unique human being, much of the interchange is lost. So another question from Jay. What is the long-term vision of the role of musicians and artists in the hospital settings at Hopkins? So again, thank you for this question. The long-term vision here is that musicians would be involved in pretty much every context in which it is appropriate. That there would be musicians offering regular publicly accessible concerts in easy to access formats, live, also streamed, I would hope, broadcast on patient TVs and on plasma screens where appropriate, and that musicians would be throughout the hospital ecosystem performing environmental music in lobbies. And I'd just like to draw a distinction between a concert and the environmental music. The point of the environmental music is to enrich the environment of care. It is not configured as a typical audience and performer interchange. There isn't necessarily clapping. People don't need to sit and listen. They can just wander by and grab whatever is meaningful to them from that experience. Whereas a concert is a more formal situation. Um, um, so in addition to the lobby and environmental music, there would also be musicians at the bedside throughout and available on call. That would be our hope. There would be music making activities for healthcare providers and for staff, um, available easily and affordably throughout through classes. Um, and there would also be musicians helping support research activities throughout different units, and really just helping to document through, high quality science what we don't know about the beneficial effects of music on healing. There's so much research to be done that really needs doing. And to do that, we need organized interdisciplinary teams, we need funding, we need research support, and we need a cadre of musicians who are equipped and ready to do this kind of work. It's actually not as easy to bring musicians into the healthcare environment as it might seem, because they must undergo all of the background checks and all of that kind of thing in order to be qualified and prepared to work with sensitive health information and with patients in any ongoing way. So that's a bit of a long-term vision. Again, looking forward to having these music-making spaces, which several of which have already been designated, having them be up and going when we're able to do that. So here's a question up from Kay. Can you share more information about the role of the arts in patient rehabilitation at Hopkins? Thank you so much for asking this question. So we have a really talented faculty member, Dr. Preeti Raghavan, whose credentials I'm going to get all mixed up, but she directs the Sheikh Khalifa Stroke Rehabilitation Unit, or something pretty close to that. Preeti comes to us from New York City, where she undertook quite a bit of research on the role of music in stroke rehabilitation. This is an area where music therapists do some work, and musicians, specialized musicians also are beginning to do work in what we call musician-supported rehabilitative therapy, where you literally have a musician either accompanying or leading some sort of therapeutic activity, which is taking place under the purview of the therapists at the same time. So we know anecdotally and through some research, but we need a lot more, that musicians who are able to provide live music and customized music to the situation at hand can inspire patients to walk further, to do more repetitions of their exercises, and to make connections that they otherwise wouldn't make. In the book that I'm about to publish, there's an incredible scenario of using music as a form of speech therapy, because the music can unlock things neurologically through the singing pathway that is not possible through the speaking pathways. So I anticipate that between stroke rehabilitation and also other neurological conditions, we will see lots more of this activity and research in the future. You also may be familiar with the work of Dr. Alex Panteliot in the neurology department, who is working on um, music supporting the care of Parkinson's patients. And we actually now have, there's a choir for Parkinson's patients and also a guitar class for Parkinson's patients intended to help with rehabilitation as well as just quality of life. So that's a little bit about what we're doing there. This is a question from B. Are there any music programs slated for the infusion centers for cancer patients and caregivers? Yes, B, yes, yes, yes. We have had periodically individual musicians in the infusion centers, but that is poised to restart when the COVID restrictions, which are even more stringent in the oncology units, when those lift, we will absolutely be developing those programs. Thank you for asking. Music has been tremendously valuable in not only in infusion centers, but also in dialysis centers, places where folks wait for a fairly lengthy period of time receiving their treatments. So thank you for that question. From Roy, this is a pertinent question. Can you say anything about the financing of musicians in hospitals? Yes, I'll speak generally, and then I'll speak specifically about Hopkins. Generally, music programs are financed either through the operating budget or a separate philanthropic effort through the hospital itself, or hospitals collaborate with arts programs to whom they basically contract the work. And those arts organizations, I'm thinking specifically of the Creative Center in New York City as an example of this, are funded through mostly through philanthropy and also through granting. So it's really a combination of philanthropy and granting. At Hopkins, I'm very, very proud to say that the president of Hopkins Hospital, Redonda Miller, had last February, March, had allocated funds both on a one-time basis and on an ongoing basis to support some of these music programs, which was a tremendous vote of confidence and commitment to this enterprise. And now we are seeking funders who would be interested in supporting this work in an ongoing way. This is a collaboration between Peabody and Johns Hopkins Hospital, and we will be, contributing both to the efforts to raise these funds. And they will be needed to help expand and grow these programs. Also seeking grant funding, as always, to supplement the grants that we already have. And if there are no more questions, which no other questions, I just want to say thank you to all of you for joining us today and for your interest in learning more about the arts and health. I will just close by saying very quickly, I mentioned this in passing, that there is the steering committee, Arts, Health, and Wellbeing steering committee that has constituents across the healthcare and university systems. And our vision more broadly is not just for music, but for the arts more broadly. So both performing arts, meaning theater, dance, and also visual arts and literary arts, all of which can be tremendous enrichments, we know, from other institutions that have engaged in programs like this for years. Thinking specifically of Duke Health, of Michigan Medicine at the University of Michigan, of Houston Methodist Hospital, and of course, the Arts in Medicine program at the University of Florida Health at Shands Memorial Hospital. So thank you for your interest, and we look forward to coming to you with more information and the development of these programs as we move forward. And I urge you all to keep safe, keep healthy, support your healthcare providers and your artists in this time. The world needs healing all around, and I appreciate your joining me. Thank you very much.